Assalamu alaikum, the communication day. First scenario, Mr. Sami is 50 years old man, known case of ischemic heart disease, admitted with chest pain, palpitation, and short of breath. ECG done and showing ventricular tachycardia. Antiarrhythmic drugs were prescribed to him. The cardiology consultant recommends insert implantable cardiac defibrillator. You are the senior health officer in the call today. You have been asked to explain to Mr. Sami his condition. Okay, we can start in seconds after sharing the timer.
Hello.
Hello.
Hello, good evening. My name is Dr. Start.
Yeah, go ahead.
Hello, good evening. My name is Dr. Al-Mahdi. I am doctor in medical ward today. Can I confirm I am talking to the Mr. Sami, 50 years old?
Yes, doctor.
Mr. Sami, we are here to discuss about your health status. That's okay with you?
Okay, doctor.
Do you want anyone attended to our meeting today?
No, doctor, no need.
What do you know regarding your condition?
And doctor, I have heart problem since long time, but before a few days I feel the shortness of breath and chest pain. I came here in the hospital. They admit me, and they told me you want to talk to me.
I'm sorry for your suffering. How are you today?
Today I'm fine.
Okay. What do you expectation from our meeting today?
I expect you will explain to me the medication.
Mr. Sami, you came to the hospital because you suffer from the shortness into the breath and awareness into the heartbeat. As I understand, you have history of heart attack before. For that, our consultant regarding to your symptom that you have was made a decision for your condition. Which they called cardio defibrillated device. Have you ever heard about that before?
No, doctor.
Do you wanted me explain more about that?
Yes, please, doctor.
Mr. Sami, because you have the problem like awareness into the heartbeat and chest pain, and also you have the dangerous type of dangerous type of the sinus rhythm. For that, our consultant is decided to do the procedure with the called cardio defibrillated agent for this the procedure to prevent the dangerous rhythm to come back to you and monitor to your heart. The benefit of the procedure to prevent the abnormal rhythm and if there's any abnormal rhythm is retaining to the sinus rhythm. If you don't agree to do the procedure, the dangerous rhythm may be affected into your life. For that, we are here to discuss how to do the procedure. That's okay with you?
Yes, doctor, please explain it to me. I don't know what is this.
Yes, this the procedure by do the some device by do the small incision in your chest above the below the bone, near from the heart, to do some cut or incision to inserted device. This the device by the wire connected to the heart. This the device make like monitor your heart. If there's any abnormal rhythm, this the device help you to prevent the abnormal rhythm retaining to the normal rhythm. And also this the procedure before the yes Are you follow me?
Yes, doctor, but how it help me? How can help me? This
Yes, thank you. Thank you
procedure.
for sharing this idea with me. This is the device by monitoring to the your heart because you're suffering from the abnormal heart rhythm. This is the device monitor your heart. If this have any attack of the abnormal rhythm, this the device is like do some parent to prevent this the abnormal rhythm and retaining to the normal rhythm for that protect you from the dangerous rhythm that may be affected to the your life. How does that sound for
How
you?
this device will work, doctor? How will work?
Yes, this the device is working by the battery. This the device have the wire. This the wire connected into the pass through the blood channel to reach into the your heart and inserted this the wire inside your heart and make your heart under monitoring.
Doctor, it looks very scary. They will enter this wire inside my blood channels while I'm awake.
Your worry is understandable, but this the procedure is important for you and protected your heart from any abnormal or any abnormal or dangerous rhythm. If you don't do the procedure, that's make you that's keep to make you in the dangerous situation. Am I clear until
I'm
now?
scared. Yes, but looks very scary, doctor.
Uh,
Will it be painful?
Your worry is understandable. This the procedure. One day, at the day of the procedure, you need to do some blood test, and make sure there's no any medical illness can be affected, needed to the postpone this the procedure. This the procedure done by the expert hand, by the expert doctor. Done this the procedure multiple time, and during the procedure you needed to give you some the painkiller to keep you not feeling to the pain, and keep some medication to keep you relaxed during the procedure, and there's specializing nurse beside you during the procedure. This the procedure under the clean condition to prevent any infection that may be happening after the procedure. After the procedure, you need, as any procedure, maybe have some side effect like bleeding, like infection, failure of the bleeding and infection and injury. But all of these is rare to happen because it's done by the expert hand, into our hospital. And also you need to monitor you after the procedure. If there's any of the side effect of any complication is happen, will be managed at once. How does that sound for you?
Okay, doctor, but for how long I will stay in hospital for this operation?
Yes, this the good questions. Can be staying to the hospital just 24 hours. After that you can go, but you can ask about anyone to drive you.
I will not drive, doctor, after this.
Just only after the procedure until to the 24 hour, because during the procedure give you some medication, some the painkiller may be affected into the yes, some painkiller, some sedation to prevent you to the drive until 24 hour after the procedure.
2 minutes
Then
left.
after this 24 hours, I can drive because I am
Yes,
bus driver. I'm bus driver. Can I drive after
yeah,
this?
I'm sorry for this. I am sorry for this. After this the procedure, you need to stop into the drive. Can ask you which your car are you drive? The owner car or
Bus,
bus drive? Okay.
bus, school
After
bus.
the procedure, you need to hold into the driving at least for the 6 week, 6 months. 6 months after that, an informed advices driving license service, and after the 6 months will be assess you again if you need to reassume driving or not.
But what will I do during these 6 months? This my job.
Can I refer to the occupational health worker to help you regarding the issue?
Okay, doctor.
Yes, but I want to tell you, after the procedure, you needed to, if you want to travel, you need to follow some. You give you some inform, because this the device may be alarm when passing to the air when passing to the airport, and also this the device have the battery needed to the change after to 5 or 7 years.
Then
If
I
you
will
agree,
come back after 5 years.
yes, after the 5 years, yes, after the 5 years, you need to change the battery of this device.
Okay.
If you agree to do the procedure, you needed to sign the consent, what we discussed today, and you can withdraw at any time before the procedure. Do you have any other concern?
No, doctor, thank you.
You want me to? Okay.
No, time is up. Okay, time is up.
Okay.
Thank
Okay.
you, Dr. Rasha. Well done. Dr. Marwa can comment, please.
Okay. Dr. Rasha explains the procedure, but yeah, before procedure, yeah, you should explain to the patient this condition and the importance of this device, and then you will explain to him the procedure as we did, and the precautions or the advices after if he agreed to do the procedures. You mentioned the alarm in security gates in airports. Also, you should talk to him about any MRI, any imaging scans, or any medical intervention. You should return to your doctor, or you should inform your doctor before doing any medical intervention. Also, you should carry medical card or medical bracelet containing information about this device. Also, you should avoid vigorous exercise or trauma. You may tell him also you may feel abnormal sensation in your chest when this device start work. Also, there will be regular follow-up in the clinics, in heart clinic. You talk about the consent. That's all.
Yeah, the driving, Dr. Marwa.
Driving is driving in group 1. Driving will restricted for 6 months. After 6 months will reassess. But heavy vehicles والجروب 2 دولت will restricted from drive for life. Because this is secondary prevention, not the primary. In primary will differ from this. The patient has already ventricular arrhythmia, so it is secondary prevention. In primary prevention will the second group, the group 2 will assist it after 6 months, as Dr. Rasha said, and the first group, I didn't remember, but less duration.
Okay.
Yes, but regarding the bus, is consider the group 1 or group 2?
Group 2.
Group 2. Okay. You need to stop the driving for forever, yeah.
For life.
Okay.
Okay. What if you don't know the duration, Dr. Rasha? You have to be ready for certain
yes.
situation you are not sure about the answer.
Yes, I am not sure. I am
Yeah.
not sure. I said I am not sure about the answer at the time
Yeah,
exactly. I will
exactly.
check, and also I will refer to the
Exactly.
DVLA to discuss. Yes.
So this is the best answer. Now we have conflict about the duration, me and you and Dr. Marwa, right? We are not sure about the clear time or the clear period when this patient can resume driving. So the best answer is I will update you or I will refer you to the group who's assigned for this question. Or you can refer him to the DVLA. They will answer you and will update you about this question. For me, I prefer to say that rather than saying 6 months or 2 weeks, you don't know the answer. You're not sure about the answer 100%. Don't mention any duration. Better to refer him. Okay, this is very important because you said 6 months and the answer is lifelong. So this is
Yes.
correct. It's not correct or it's wrong answer. So it will affect your clinical judgment.
Yes. Clinical judgment. Yes.
Yeah, so better to refer him or to tell him I will check it in the policy or the guidelines and I will update you in the next meeting.
Yes.
But if you are sure about the answer, you can tell him that. This is regarding the driving issue. The drawing is very important, Dr. Ash. I wrote in the chat box to draw. Any procedure, remember draw.
أنا مش عارفة
Procedure,
بصراحة كيف أدرو على
yeah, it's
السكرين.
okay. No problem. You can see the pen in the screen. Then choose the color and start to draw. As I said, I as a draw now. Okay, you can see on the screen. There is a pen in the screen in the Zoom meeting. You can choose. Try to do it now. The pen. There is pen on the screen. You see the pen?
لا خلاص مش مشكلة. Other time I will try.
No. It's on the Zoom meeting. I want you to train how to draw in any procedure scenario. Why? Because you will forget. I want you to do it. Anyways, the drawing here will help the surrogate to understand what you are talking about. As Dr. Marwa
Yes.
asked you many times, how, doctor, how you will do it. So simply, while drawing, let's draw it. Okay. This is the patient body, for example. This is the chest. This is the arm. And the heart, let's make it in the red. Heart will be here, for example. How we will go through, as you said, there is cut incision here, for example, in the chest wall, small cut incision. Why will go under, of course, numbing agent. Numbing agent. Why? Because he will not feel pain. One of the concerns was about the pain. Will I feel this pain? No. We will give you, and our doctor, our pain doctor, will be accompanied during the procedure. Why? To be sure that you don't feel. Okay, so this incision. Sorry, Dr. Marwa,
I
yes?
sent to Dr. Rasha a picture of the pen sign. صورة القلم في الصورة.
Okay. So under this cut, the machine or the battery or the device will be implanted under the skin. What will happen after that? As you said, there is a cable or a wire. This cable will be connected, implanted under the skin, and it will go to the heart chambers or the heart rooms. And the aim of this procedure is to abort any abnormal electricity. Why I said electricity? Because this is electricity. There is pulse, right? Impulse comes from the nodes, SA nodes, but you will not say this, but in simple way, you will say this device or this device through the wire will abort any impulse or any signal comes from the heart, which can lead to the abnormal and dangerous beating. Okay. Rhythm, okay, yes, also rhythm can be. So it will abort any abnormal rhythm or abnormal beating happen to the heart in order to prevent this danger rhythm. Okay, clear now?
Yes.
Okay, as any procedure, how to talk about the procedure itself. I started to draw and to, let's draw also the wire. The wire will go like this in the heart. Okay, as any procedure, you have to remember the cornerstone of the procedure, starting before and during and after. Simply, any procedure, write these three words as a skeleton for explaining the procedure. Before the procedure, you will be admitted to the unit, which is called, for example, daycare unit or any wards, according to the hospital. You will be seen by the pain doctor. They will do for you some blood test workup to be sure that you don't have any bleeding problem. After that, of course, one of the important things in this scenario, the consent, already explained later on, but don't forget it, it's something essential. This is before. What about during? You will go inside the room of the procedure. You'll be sleeping comfortable under observation of pain doctor and the heart doctor. We will be sure that you will not feel any pain. One of the concerns for any procedure or any surgery, the pain. You have to reassure your patient that he will not feel the pain. It's very important, especially if he raises this issue. You have to answer it. Yeah, you will not feel pain. You have to tell him that you will not feel pain, or at least you will feel pain-free as much as we can. No guarantee that he will not have pain. Even with the painkiller, he might have pain. He might have pain, yes. Okay, this is regarding the pain management. What other management will be done there? It will be clean, under clean situation. They will clean the area, often the cut or the incision. And as you said, the wire, as I said earlier, also the wire will be inserted or the cable connected to the heart wall through a blood channel, and the battery will be under the skin. This is during. After, after the procedure, you will be monitored for a couple of hours. You don't know, is it 24 hours or more or less? So the best answer, couple of hours, you will be observed. If everything is okay, you don't have pain, the machine is working well, the programmer followed you and adjusted the machine, and everything is okay, the consultant will have a look to you, and if everything okay, you can go home. And as you said, it's very important, and which is good also, someone can drive you home. Let's go to the complication. You have to mention the complication for any scenario, which you miss this scenario. What possible complication for the ICD? As any procedure, two P's, two I's, right? Bleeding and pain, infection and injury. Bleeding, yes, because you are going to the major vessel and to the heart itself. Pain, as any procedure, you might have pain, either during or after. The eye, two eyes, injury, you might injure the heart itself. It might injure the heart wall itself, or it might hurt the vessel itself, the blood channels. And other eye infection. As any foreign body in the body, it might get infected with the time. However, we are using clean technique and we have expert hand, as you said, skilled hands. Many times they did the procedure. So everything will be discussed with you about the possible communication. And let me assure you that everything will be fine, okay? If you spend the time explaining these things, at least you do 6 minutes. The preparation during, before, and after, the complication, which is the most important thing about any procedure. You have to mention all of these. The consent form, of course, you have to mention, and anytime you have changed your mind, you can withdraw. Some tricky points, as you mentioned, during travel, the security gates, during doing MRI, you have to mention these things as red flags or instruction. Please inform your doctor that you have this device whenever you are going to do MRI, which is a machine can use the magnetic field to diagnose you about any disease related to the nerve condition. It's called MRI. Please let your doctor know that if you are going to travel, as you mentioned. After finishing all this, you can ask about the social. Do you smoke? Do you drink alcohol? It's important here. Yes, it's important. He has heart disease. Smoking and alcohol had harm on the heart, direct harm to the heart, or either by alcoholic cirrhosis, or sorry, alcoholic cardiomyopathy, or the smoking as atherosclerosis and arrhythmia and so on. What's your job? Whatever his job, you have to address it. In this scenario, he's bus driver. I'm so sorry. You might have some ban from driving. I'm not sure about the duration, but I will update you on the next meeting. Do you need any support? Yes, doctor. How I support my family at home? I will refer you to the occupational worker to reallocate you in another job which is not harming you. For example, office job. He can go to the office, right? Can work in an office. So he will not have any harm to others. What the problem of ICD and driving, particularly bus? He might have these attacks of arrhythmia, V-Tach, even cardiac death or cardiac arrest leading to death. And he's driving a lot of lives, passenger, right? So they will be at harm. So the best thing to reallocate him in his office so he will not harm any. Plus some sick leave after the procedure, you can offer him sick leave post-procedure. Let's go to the driving point. What I remember about ICD, I think, I'm not sure also about how many weeks. I think it was 1 month after ICD for the type 1. Dr. Marwa, you can correct me if you have a clear information.
The difference between primary
How many?
prevention and
Yes,
secondary
primary prevention and secondary prevention. But I think this patient primary prevention.
No, this
Primary,
patient
yeah.
secondary. This patient has already ventricular tachycardia.
Yeah, so yeah.
ECG.
You mean the diagnosis? Yes, okay.
Diagnosed and have arrhythmia.
Yeah, if he had, so it will be secondary. If he
Second.
doesn't have it
If
before,
it doesn't have, for prevention
exactly.
only,
So
this
yeah,
primary.
yes. Okay.
Secondary prevention will be banned forever for group 2 and for 6 months for group 1. This for secondary prevention as this in this case. For primary, I think 1 month and 6 months. 1 in group 1 and 6 in group 2. But I'm not sure for the primary.
Yes.
Okay, we will check it and update it to the group, to the WhatsApp. Okay.
But I think a primary is secondary if the patient arrested by V-Tach, not only diagnosis by V-Tach.
Not only arrest, if he had
No,
the
I
V-Tach.
arrest.
Yeah. If he had any V-Tach before, so this is secondary prevention. Some V-Tach might lead to arrest, but some V-Tachs may be discovered and witnessed at hospital. It could be managed appropriately without cardiac arrest, right? He might have received the DC shock, for example, and he didn't have arrest. Okay, there is sustained and non-sustained V-Tach. Anyway, not this. This is not the topic. The ICD for Holcomb, for example, it's what's called primary. Why? Because I'm preventing such complication might happen in the future. But if already happened, this is called secondary prevention. According to the DIVLA or the rules or the guidelines, every group has different duration to ban from driving. I'm not sure about them, and I think no one will have the clear information in the exam. To the best answer, I will return to my senior. I will ask the team related to this driving issue, or I will refer you to the DVLA. Why? Because this patient will have long time ban driver. So you don't think he will drive, for example, after 1 week or a week or 1 month, unless he's on driving his own car. Type 1, I mean. Type 1, yes, you can say maybe after a couple of weeks you can drive, but let me be sure about the answer, then I will update you in the next meeting. For example, this is the best way how to answer, and don't play this game with the surrogates. Don't give him clear answer. The clear answer for the examiner means either minus, or maybe if the answer is correct, yeah, he will give you the correct the marks. But if the answer is wrong, it might minus you, right? But if the answer is, for example, I will update you in the next meeting, it's correct answer because you didn't give a clear timing. So this is the best way not to give a clear answer if you are not sure. But if you are sure, you can give the correct answer. Okay. Anything we miss in this scenario? Yes, Dr. Marwa, sorry. Who's talking?
No, 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 just only yes.
Okay. Okay. Clear now, Dr. Rasha, and try to, yes, you are keeping us, the patient or the surrogate, are you following me? Did you understand me? Which is good, but try to give him a chance to talk. I mean, don't explain long details and more details about the procedure. Let him talk as a conversation way. And when he asks you a concern, special or clear concern, answer him clearly. One concern, Dr. Marwa asked you about I think, pain. Yeah, it looks scary, doctor, to do this procedure, and you give her another answer. So be clear, target the answer according to the question. Okay. So if Dr. Maro, for example, asks about what about pain, doctor? Will I have pain or will I feel pain? Yes, you can say I appreciate your worry. It's understandable to worry about pain, but be sure that we will give you a painkiller, or the pain doctor will be there. He will help you not to feel any pain in this way. So they answer according to the concern. Okay, clear now all? Let's move to the next scenario. Anyone has question or concern? Clear. Let's go to the second question. So, sorry, second scenario, Dr. Marwa. Dr. Rasha, you can share the scenario.
Yes.
Okay, I will share it now. Dr. Rasha send it to me. Dr. Marwa, your scenario. You are the doctor in the medical unit. Mr. Omar, 35 years old. He's a college student, diagnosed to have ulcerative colitis 9 months ago. He was about to start oral steroids after failure of rectal forms, and he's worried about the side effects. The task is to explain the further plan and address his concern. I will share it now to the chat box. So ulcerative colitis, explain about steroid. You can see your scenario now in the chat box, Dr. Maro. When you're ready, let me know. Really? Dr. Marwa, your sound is very far. We cannot hear you, Dr. Marwa.
Clear now?
Yeah, very clear. Here you go.
Okay. Hello, good morning.
Yes, hello.
My name is Dr. Marwa, one of the doctors in the medical unit today. Can I confirm you are Mr. Omar and you are 35 years old?
Yes, I am.
Mr. Omar, we are here today to discussing some issues related to medical condition. Is that okay with you?
Yes, doctor.
Do you need anyone to attend this meeting with you?
No, no.
Okay. Before starting, can you tell me what you know about your medical condition?
Yes, doctor. I suffer from loose motion since 9 months. Sometimes the loose motion with mixed with the blood, and also have tummy pain. I don't know, doctor. The doctor said to me I have some problem in my gut. Started some medication for me, but I think, doctor, there's no any improvement. I still have loose motion.
Yeah, I'm sorry for this suffering, Mr. Omar, and we are here to help you.
Okay.
Do you have any expectation from this meeting?
No, doctor.
Hello?
No, doctor, no. I don't have any
Okay.
expectation.
Okay. Yes, as you said, you diagnosed by a condition in your gut called this condition is called ulcerative colitis. Did you know about it, or you want me to explain it to you?
Yes, doctor, please.
It's some type of soreness in your gut, making you feel this tummy pain and loose motion, and sometimes this loose motion mixed with blood. And the medication for this condition, uh, um, as you started with some type of medication uh, by rectal form, but unfortunately it is not improve your condition. So the consultant said to shift you to another type of medications. Are you with me till now?
Yes, doctor. Which medication?
The second medication, the consultant want to start it with you is called steroid. Do you know about it or heard
Yes,
about it
doctor.
before?
Yes, doctor. I know about this medication before.
Okay. This steroid.
No,
Um,
doctor. I don't know to start this medication, doctor.
can I know why?
Because this medication has a lot of side effects, a lot of the complication. I read it before about this medication. I can't start this
Uh,
medication, doctor. There's
I
any other
highly,
medication?
I highly appreciate your concern. It is very valid, and as you know, every medication have side effects. And yes, steroid have side effects. I will tell about it to you, but I want to tell you about its importance in your condition. This has very effective. Uh, it is very effective in your condition. It help the healing in this soreness in your gut and expected to improve your condition very quickly. And it is usually it is not permanent for long time. It is for short time, and uh, we will shift you to another medication after stabilizing your condition.
For
Uh,
how long, doctor? I will use this steroid?
It is not, we can't expect now, but we will follow up and follow you and watching your response to this medication. And at the same time, we will give you some medications to decrease side effect or the bad effect of this medication. The most common bad effect of this medication is feeling like sickness or soreness in your stomach. And for that, we will give you another medicine with steroid to help relieve this soreness in your stomach and protect your stomach from the effect of this from the steroid. Also, we will monitor your blood sugar and blood pressure. They may increase while you're taking this steroid. So, close monitoring will help to detect any side effects develop while you're taking steroids. Are you with me till now?
You mean, doctor, if you monitor me, I don't have any of these side effects of steroid?
I mean, while we monitor you, we can detect any early change in your blood pressure. We can deal with that with giving you medications or modifying the dose of steroid according to the complications develop and also according to your response. Our eyes will on you all the time. Don't worry about this. And all medications, all the side effects can happen. We will monitor you.
Yes, doctor.
What?
But there's any herbal medicine or anything can I use?
I highly appreciate your concern, Mr. Omar. But in your condition and in this type of disease, your this type of disease of ulcerative colitis is the type of autoimmune disease. Autoimmune disease, that means your own defense system start to attacking your body. And this disease start to attacking your gut. The role of steroid in this disease is to prevent this defense system from attacking your gut. And the best medication to use this role is steroid. So we describe it to you in the best interest of your condition. Is that
Doctor,
clear for you?
yes, doctor, steroid can cause cancer?
I highly appreciate your words, Mr. Omar, but no, steroid not cause cancer.
Yes, doctor. But doctor, I can't start this medication. Please, doctor.
2 minutes.
Give me medication.
Why? Any other reason?
Yes, doctor. Also, steroid can increase weight.
Increase weight, we will give you the least effective dose that not expected to increase weight in this dose. But we also, as I told you, will monitor your weight and your blood pressure and your blood sugar, and all expected side effects will be under monitoring. Can I know what you do for living, Mr. Omar?
I am study in college.
Okay. Do you drive?
No.
Do you smoke or drink alcohol?
Yes, doctor, I smoke.
How much for how long?
5-6 cigarettes per day.
Okay, I highly advise you to stop smoking because it is very harmful to your general health. In spite it may improve your specific condition, but it is for your general health and your heart, your lungs, it's very harmful. If you need any help regarding stopping smoking, I can help you if you want.
Yes, doctor, thank you. Doctor, but I have sometime I can't go to the college because lose motion.
I'm sorry for that, Mr. Oma, and because of that, the consultant decided to shift you to this new medication to achieve both best improvement in your condition. Because it's the best drug in this stage. When you start steroid, it's expected to notice big improvement in your condition and your loose motion and your tummy pain
Okay,
will
time
improve.
time is up, Dr. Marwa. If you have 20 seconds, what you would say, or 15 seconds, quickly, or 10 seconds.
Uh,
If you have 10 seconds remains.
I will talk about complications of ulcerative colitis if not take proper medication.
No,
You
10
may
seconds
suffer.
means you are about the meeting or decision or the station about to be finished. Means
I
the
will,
closure. Yeah, with the closure.
I will ask, do you have any other concern?
Okay, everything completed. And there is 10
I will
seconds.
offer to
Yes, it's very important.
brochures on websites.
Exactly. Why you will offer brochures and website and leaflet? Because you will not cover
read.
the whole
Mm,
complication of steroid. Yes, yeah, to
yes.
read about it and let us know if you have any inquiry. Why? The steroid as a complication or the complication of
Mm,
steroids is very huge. You didn't cover and you will not cover it in one station. Okay, so
mm,
you have to offer this. You have. Don't forget to offer it. I will offer you, or I will hand you some leaflet brochure to read about steroid and possible side effects, and let us know
mm,
if you have any inquiry. 10 seconds or less, you can finish this sentence, and same time you cover the whole complication, although you didn't explain. Okay.
mm.
Otherwise, well done. Let's
Yes.
hear Dr. Rasha, then I will comment. Dr. Rasha, please.
Yes, Dr. Marwa, well done. But في some comment regarding definition of explanation of ulcerative colitis, it's incomplete because ulcerative colitis, the soreness of the gut due to the disturbance in the defense system is mistakenly attacking to the your bowel. عشان you say كلها one sentences is not يعني is not come back again وتقولي due to the defense disturbance في immunity system. Presented with the symptoms such diarrhea, lose motion, blood كذا, weight loss, abdominal pain, كذا كذا. The patient, once the consultant asked the patient the importance of the steroid, you need to put the patient the important to start the steroid and the important and the serious if the patient is not started the steroid. The patient you need to start the steroid because steroid can be improve into your gut, improve your symptom. If you not start the steroid, you're suffering more and you're more soreness and more كذا كذا كذا. عشان the patient to convince the patient doesn't تعطي give the benefit and the risk. If the patient is still is not confused, still is not convinced, maybe arrange it to the other meeting with the consultant. الفكرة بس في ulcerative colitis in the patient, this the medication, yes, the patient has a lot of side effect, but the medication is given for low dose for the only يعني given the steroid only في acute stage من ulcerative colitis. This the complication can maybe happen, can maybe not, because different from the patient to the patient. The steroid is given for the short period في acute stage of acute flare up of the disease and low effective dose. But the complication can maybe happen. هذه كانت يعني most important in the steroid for يعني I think for 4 week low effective dose will monitor the blood pressure وmonitor the blood sugar. If you have the complication happen, it's okay. When the patient asks about if there's any herbal medication, there's no evidence base regarding to the herbal medication treated steroid, but the steroid is the most effective treatment. Otherwise is good يعني.
Okay, thank you, Dr. Rasha. Let me comment from the start. As an introduction, it's done well by Dr. Marwa. The introduction, introduce yourself, the expectation, the background of the disease, and the invitation. You can ask someone to attend, yes. The other point, the explanation of the disease. I agree to ask him, but not to repeat what he said. Yes, you have diarrhea and loose motion. No need to mention. You can start immediately explaining what he has in one question. Or after saying what he has, then you can offer the question. So what you will say? According to the symptoms you have, the consultant made a diagnosis of ulcerative colitis. Have you ever heard about ulcerative colitis? No, doctor. What is it? Now you explain. So don't say the symptom. Don't say you have loose motion, the tummy pain. No, he already presented to you with this, and he told you that I have tummy pain, diarrhea. So no need to repeat it. Okay, it will save some minutes or some seconds, but it will help you later on because you need to use and utilize every second. Have you ever heard about ulcerative? No, doctor. You want me to explain? Yes, please, doctor. Of course. You will start to explain, as Dr. Rasha said, it's autoimmune, which lead to soreness in your gut or the inner area of your gut. And with this soreness, you will not get a lot of benefit from the function of the gut. Instead, you might have loose motion, you are losing blood. All this happen because of the defense system misleading. It will attack your gut instead of attacking the bugs. In order to help you to treat you, the consultant prescribe for you medication called steroid in the best interest of your condition. Have you ever heard about steroid? No, doctor, don't start steroid, as Dr. Rasha assume. No, doctor, don't start steroid. I know about it and I don't want to start it. Immediately address why. Why you don't want to start? I believe if the surrogate told you from the start, I don't want, it's a good question and it's good beginning to address the concerns. Why? Because the concern will start from here. No, doctor, I don't want to start. May I know why? Yeah, doctor, I'm worried because, for example, my uncle has a steroid and it harmed him. My cousin, my whatever, he will mention to you, and according to the concern, address it. Why? Because you might talk about a lot of complication, but still his concern related to certain complication and he needs you to talk about this. For example, if he asks you, doctor, I don't want to gain weight. So you will address the weight gain. If he said, no, doctor, I heard it's causing high blood pressure, it's causing high blood sugar. So you will address this concern and it is one of the complication you are going to explain it. But by this way, you already target the concern plus explaining the complication. So the best answer for the gaining weight, as Dr. Rocha said, it's not high dose, and we will refer you to a dietitian. They will help you how to eat these days. Again, the dietitian will help you also how to take the good intake, will help you also to overcome the loose motion because he need to be corrected and compensated with fluids, right? Any patient with diarrhea, he should be on some supplements, for example, some proteins replacement, water intake. So anyway, he will be referred to the dietitian. The next point, the hypertension, high blood sugar, hypertension. you address already. So we'll keep you under monitoring, close observation with follow-up. We will avoid the complication of high blood pressure, high blood sugar. The next is the bone protection. You didn't talk about it at all, bone protection. So we will give you some supplements to help not to have any weak bone in the future. Although it's short term, but of course the recurrence of the
Yes, but I think bone protection is long time.
yeah, I agree. But you don't know for how long the patient will receive. Anyway, he will tell you about it if he heard about it. If the patient hear about, for example, osteoporosis, he will tell you, doctor, I heard about this. So the best answer or the best way to address it before he will ask you. It's one of the complications. However, in your condition, it's not common because you are not taking the steroid for a long time. The second or the third, the fourth, or whatever the number of the complication, psychosis, cataracts, all the things he might read about it and he will be worried about it. So you have to reassure him it's for a short time. And anyway, we will let you know how to avoid these complications. Again, in the best interest of your condition, this medication have a lot of benefit. And always we are weighing the benefit versus the risk. In your condition, is steroid and the risk for your condition, and it outweigh the risk. That's why the consultants see or thinking that it's the best interest of your condition. Try always to mention the best interest. Why? Because best interest means this is the only choice, or this is the first choice. Other choices, yeah, there is, but this is the best interest. And he will close the other doors for other alternative. He will tell you herbal. No, the best interest is steroid. Herbal, any herbal medicine can help, but no evidence base. Okay, but the steroid, we have evidence base that the steroid help in your condition. This is the way how to convince any patient for any medication. And if he asks for alternative, try to convince him that the alternative always come inferior, or don't say inferior, you can say it's another choice or it's not the first choice in your condition. And always keep saying this interest. Okay, this is for the possible side effect and how to address the complication. Finally, as you said, and Dr. Marwa did, the social support. What's your job? Don't forget to always to ask, what's your job? How is the impact? What is the impact of these symptoms on your job? I am a student. Oh my God. Of course, he will tell you that if you didn't ask him, he might tell you, but you should ask him. I can see how it's distressful for you. Uh, do you think there is difficulty in your studying from this disease? Yeah, doctor, I'm suffering going to the toilet many times. I'm so sorry for your son. So you will address this point if you ask about the impact. But if you don't ask about the impact, they consider it one of the communication skill, clinical communication, and they might minus you. Yes, you have to ask about the job and the impact of this disease on the job. Not every disease will impact on the job. Okay, so you have to ask about it and to address it. If he has some impact, you have to say to share with him some empathy. Okay. Next is the driving. Here, if I don't think it's need to be asked. The smoking and the alcohol. He might ask you about the smoking, or he might tell you, Doctor, I read in the internet that smoking help in the ulcerative colitis, as Dr. Marwa explained in advance. But if you didn't, it's okay. He will ask you. If not, no need to mention it. Okay, Dr. Marwa. So you can just wait for him to tell you, I read that the smoking help in some patient with ulcer. Yes, I appreciate your knowledge about this point. I appreciate sharing this with me. However, if it help sometimes, but in the long term, the smoking always harm the patient, and it's always dangerous uh, to the whole body, not only the gut. Yeah, this is the way how to wait for him how to address what he is thinking about, and you expect he will ask you this condition. So no need to mention it earlier. You can wait for him to ask you, then you can explain it to him. Okay? Clear, Dr. Marwa?
Yes, doctor. Okay.
Okay, if you didn't cover all complication, and I agree and I believe maybe one or two complication might be missed. How to do or how to overcome this problem? Simply at the end, I will hand you some leaflet brochure about the steroid, the indication, the uses, and the possible side effects. Any concern? No, doctor. If he has concern, address it. If no, you can summarize, you can support, or sorry, offer support, you can summarize, you can ask him to summarize, or you can talk about red flags, about, as you said, the ulcerative colitis. What might happen if he has flare? You might have what's called flare. These flares mean you have a lot of loose motion. It might reach up to 6 times per day. In this condition, you have to drink a lot of water, plenty of water. Why? You might have what's called dehydration, and it's harming your body. It might harm the kidney. It might lead to a dryness in your mouth, dryness in your eyes. So, in order to avoid the dehydration, please, whenever you have many times of loose motion, try to compensate with water and fluids. The red flags always something beautiful to close the scenario or to close the station with it. Red flags and leaflet brochure. If you have time, of course. If you don't have time, at least do the task. The task here is steroid. Okay. Any question? Is it clear now for all? Okay.
Yes, clear, doctor. Thank you.
Okay. Thank you. Thank you, Dr. Marwa and Dr. Rasha. Any question, Dr. Rasha? Okay, clear. Anyone has question or concern or suggestion?
Yes, clear.
Dr. Maida join us, I think. Yeah, Dr. Yeah, thank you, Dr. Maida, for joining. I don't know what happened to the number. Anyway, I will try to give a promise that at least I have the two participants in the session. I will run the session, whatever the number, even 3, 4, 5. At least I have the two participants. Hopefully, I will do and I will run the session. And please try to attend the coming 3 days because I will have vacation maybe at next week. But even during the vacation, I will try to run this session. But at least I will have the two participants. If no two participants, unfortunately, the session will be cancelled. Okay, I insist to say this sentence at the end for those who will have the next diet exam or they are applying for the next or the next after the next diet. It's not a matter of I don't have an exam date. No, it's a matter of how to be ready whenever the diet open, because whenever the diet open, you will have 3 or 2 months, and believe me, you have to build up your trust, you have to build up your confidence, how to practice, because if you start to practice within 2 months only, maybe it's not enough. Okay, we'll see you tomorrow, inshallah, after tomorrow. Tomorrow is Friday. Yeah, thank you, Dr. Maida. Thank you, everyone, for the attendance. See you tomorrow, or sorry, have a nice weekend. See you on Saturday with the clinical consultation. Next week, we'll have Saturday, Sunday, Monday, long and short, sorry, long and communication and short. Then I will have flight on Tuesday. After that, I will arrange the meeting according to the participant. If I have participants, I might run the session. If not, I will enjoy my vacation. See you next week, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.